Hello friends, I'm Dr. Indira, Gynecologist in OneHealth Hospital, Vandalur. Today we are going to see something about this irregular cycles, which is very common in the female population. See, before going to the irregular, you have to know what is normal cycles. See, if you are getting once in 28 to 30 days cycle, that's normal, which is lasting for 2 to 7 days. That's always normal. Even if you are going to get cycles within 21 to 35 days, that is also considered as normal. But if your cycles are less than 21 days or more than prolonging for more than 35 days, it is considered as abnormal. And if you are getting any intermenstrual spotting, that is in between period, if you have any bleeding, that is also abnormal. So these are all the situations you have to consult a gynecologist. See, sometimes you may get irregular cycles. Everybody will get irregular cycles in the reproductive age group. But if your irregular cycles are more than 3 consecutive cycles, then you need to see the doctor. Most common cause for irregular cycle are the stress factors. And again, apart from that, after puberty, after you attain your menarche, first 1 or 2 years you may have irregular cycles. That is also common. And like that, perimenopausal, that is around 45 to 50 years, you may have little bit of shortened cycle or prolonged cycle. But remember one thing, even if you are going to get short cycle or prolonged cycle, your bleeding should not be heavy. Please remember that. Your bleeding has to be lesser than what you are getting prior. So if your bleeding is more, or if you are getting very frequent, 20 days one cycle, during that 40 to 50 years, you have to consult your gynecologist. So in between time, most commonest cause is the stress induced. Second is the PCO. We all are talking about, we will see about PCO in a later video. Most common is obesity. Another common is the obesity. So these are all the broad outline for you to know about the irregular cycle. So in nutshell, if you have less than 21 days or more than 35 days prolonged cycles for more than 3 consecutive months, you have to see your doctor. And at the extremes of reproductive age, that is after puberty and before menopause, irregularity is little common, but it should never cross the normal flow, that is 5 to 7 days, especially during your perimenopausal time. You are not supposed to leave if you are having, say for example, if you are having 3 days cycle prior, now it is 5 days, 7 days, it is pathological. You have to consult a gynecologist. Okay, thank you.
OneHealth Super Speciality Hospital, GST Road, Vandalur. புதிய கிளாம்பாக்கம் பேருந்து நிலையத்தின் எதிரில். தொடர்புக்கு 0944502558. உங்க ஹெல்த்துக்கு OneHealth இருக்கு.